Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, Jerry Hickey here, a pharmacist nutritionist. I'd like to talk to you today about corticosteroid drugs. They're commonly called steroids, and we're not talking about the sex hormone steroids here. We're talking about the ones used for inflammation. They're very powerful anti-inflammatory drugs. Some examples that you'd get on prescription would be hydrocortisone, prednisone, methylprednisolone. They're typically used to treat inflammatory-related diseases, such as rheumatological diseases. Rheumatological diseases are typically autoimmune diseases where your own immune system is trashing your body, like rheumatoid arthritis that affects your joints, systemic lupus erythematosus that could attack your kidneys and your heart and other tissues. Vasculitis, that's inflammation of the blood vessels. I mean, that's pretty dangerous. It could throw off a blood clot. So they're also used for asthma, inhalers that help prevent attacks, not the best strategy. For severe allergic reactions, severe muscle pain with severe inflammation, and many other important indications that will be covered later in the episode. A major issue with these drugs, when they're used for an extended time period, is they have a bundle of side effects. And I'm just going to talk about the more common ones. But what's rarely covered by doctors, and certainly not by the drug companies, many important nutrients are depleted by these drugs. And this can have serious health consequences. In fact, I've often wondered if many of the side effects caused by steroid drugs is due to these depletions. So you need to replete these nutrients. So hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. Welcome to my episode, Corticosteroids, Side Effects and Nutrient Depletions. Thanks for tuning into the Invite Health podcast episode today, and you can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health, and the information on this episode is linked at the episode description. I have a lot to say about this, but I will really go into depth on the nutrients that are depleted and the consequences of that, because that's also a tutorial on how important these nutrients are in the first place. So a really big issue with these drugs are the side effects and the nutrient depletions. The corticosteroids are made in labs. They closely resemble our own hormone, cortisol. Now, that's a hormone that's made by your adrenal glands. Your adrenal glands are these triangular little glands. They sit atop each kidney, and they release certain hormones that control your blood volume and the amount of electrolytes in your blood, such as sodium and potassium, hormones that control your blood pressure, but also sex hormones, but also hormone, especially for men, and also these steroid hormones. And these steroid hormones have a number of activities. In the body, you release the steroid hormones to wake up. You release some cortisol and some epinephrine from the adrenal glands to wake you up because they squeeze your blood vessels and make your heart race a little bit, beat faster, so that gets blood up to your brain and to your muscles, and they increase your blood sugar. So that feeds the brain some sugar so you can wake up. But you can imagine long term, if you're releasing these hormones inappropriately, how bad that would be for you. Well, the same thing can happen with the drugs. So examples of steroid drugs include tablets like hydrocortisone or Medrol dose pack, injections, eye drops, like if you have an infection in the eye, they don't want the infection to destroy your eye, so they give the cortisol type eye drops, the steroid type eye drops, to prevent inflammation and damage in the eye while they're giving an antibiotic at the same time. They're used for asthma, they're used for nasal inhalers for like sinusitis, that's also not the best strategy, or for nasal polyps. There's air drops, there's skin creams. If you use the skin cream too often, it's going to thin your skin, by the way. They're also used as injections into the spine for people with spinal pain. They don't work that well in the spine. The effects wear off rapidly, but they do build up scar tissue. It's not a good thing. And by the way, if you get a steroid injection into a tissue, if you get more than 2 injections, it starts to melt that tissue. You never want more than 2 steroid injections in one spot. So how do they work? Steroids work by decreasing inflammation and reducing the activity of your immune system. So it's calming down the white blood cells, in other words. It's calming down the cytokines. Now, the problem is sometimes the body's own immune system is attacking your tissues. You get this in arthritis with joint damage and severe pain. You get in asthma in the lungs. You get it in prostatitis in the prostate, interstitial cystitis in the bladder and the urinary tract. So there's all kinds of examples of inflammation. And over time, severe inflammation can destroy tissues. I mean, a big example of that is Alzheimer's disease. This persistent inflammation starts the whole process going of Alzheimer's disease. By the way, what are the common signs of inflammation? Redness, warmth, swelling, pain. So the steroids reduce the chemicals that cause this inflammation. This helps keep the tissue damage to a minimum, as low as possible. So the steroids are reducing the activity of the immune system by affecting the way the white blood cells work and the immune system messengers work. So examples of these corticosteroids, which are called steroids, would be betamethasone, prednisone, prednisolone, which isn't used that often, triamcinolone, methylprednisolone, dexamethasone. Those are the ones that are really used. There's some others, but they're not used. So when are these steroids prescribed? Well, colitis, but there are newer drugs that are more selective for the damage done in colitis. Severe allergic reactions, severe skin reactions and skin rashes, systemic vasculitis, which is inflammation of your blood vessels, which is very dangerous. Myositis, that's inflammation of the muscles. So if it's very bad, I mean, it could be really harmful. They'll give like a Medrol dose pack, and you use that up within about 5 days. Rheumatoid arthritis, which is an inflammatory autoimmune arthritis that destroys like your knuckles in your hands, but it could damage any joint. A systemic lupus erythematosus, that's a generalized disease around your system that can like damage the heart and the lungs and the kidneys, etc. If it's a low dose of a steroid, generally there aren't problems. For instance, if you're using prednisone at 5 milligrams, it doesn't usually cause a problem. But if you're using higher doses, the longer you use it, the more likely you're going to have problems. Like you can even start hearing voices and have psychotic episodes. It could cause weird types of anemias and blood dyscrasias, damage to your bloodstream. But these are the common side effects. Increased appetite, so you gain weight. But it also makes your salt and fluid go up in your body. It causes fluid retention. It causes your sodium to build up. But it also causes you to lose potassium in your urine. So here we have nutrients affected by steroids, and this results in swelling. So part of the reason you're swelling is you're retaining salt and you're losing potassium. So you get edema in the legs, swelling in the legs. But you also get high blood pressure. When you retain salt and you lose potassium, you get high blood pressure. So the steroids are also causing your blood vessels to narrow and your heart to race a little bit. All of these things lead to high blood pressure. But part of that problem is the loss of potassium. So here we have one nutrient and one major common side effect of the drug, and there's a relationship there. You're losing potassium, your blood pressure is going up. It's not all due to the loss of potassium, but part of it is. Your blood sugar goes up. In fact, if you take a high dose of a steroid for too long, it could drive you into diabetes. Changes in mood. It can make you depressed. It can make you anxious. Muscle weakness, blurry vision, even the onset of cataracts. You can have hirsutism, like your growing body hair. You could bruise easily. And of course, because it's affecting the immune system, it's easy to develop an infection. So for instance, vaccines won't work as well, antibiotics won't work as well, your immune system isn't working as well. It can actually lead to fungal infections. Fungal infections are quite dangerous. You always have many strains of yeast living with you. They're living in your intestines. There's at least 7 different species of yeast living in your intestines. And when they show a yeast cell on the news, they show it in a dish called a petri dish, and they show like a singular cell. But that's not how they infect you. When they infect you, they develop hypha. They develop these thread-like filaments that burrow into your tissue, and they're harder to kill. And they tend to make a biofilm where they're protected from the antifungal drugs. So because you're on a steroid long-term, you have to be aware that you can develop a fungal infection. Is there anything that can help inhibit a fungal infection? Yeah, the nutrient resveratrol has antifungal activity. I mean, that's one reason why it protects grapes from mold, right? And grapeseed extract has some antifungal activity, so you could take some of that to help protect yourself. Now, it's very common to develop something called moon face. The face gets swollen and puffy. If you ever saw Jerry Lewis, if you know who he is, if you're old enough to know who he is, his face got all swollen when he was on steroids when he was older. It can lead to acne because it affects sex hormones. It can lead to real bone loss, real demineralization of the bones. You can develop osteoporosis. In fact, it increases the risk of a hip fracture. Definitely irritation of the intestines. You might want to take something to protect your digestive tract if you have to stay on these drugs. Like a good example of something to protect you would be Prolipar zinc. It's a combination of carnosine with zinc, and because they're joined together, they hang out in the intestines longer, and they're very healing for the intestines. So I told people that are on drugs that could damage their intestines, like calcium channel blocking drugs for high blood pressure, like nifedipine, or amlodipine, or these steroid drugs like hydrocortisone or Medrol, prednisone, or NSAIDs like Advil and Aleve. Take something like that to prevent ulceration, because these ulcerations can be quite severe. These drugs commonly lead to nervousness and restlessness, and once again, I wonder if that's because of depletions of things like B vitamins. I wonder if that's compounding the situation. Can the drug normally lead to nervousness and restlessness? I don't doubt it, but I think that the depletion of certain key nutrients is going to make that even worse. It's going to aggravate that situation. Insomnia. I already said cataracts, but I should have said glaucoma. Also, and another one is Dowager's hump. It's also called buffalo hump. Fat builds up on your back. You get like a Quasimodo kind of thing. So these are the most common side effects. There's many others. If you use corticosteroids at a higher dose, not a low dose, long term, it can lead to obesity. In children, it could prevent them from growing. It can lead to psychiatric disturbances, including depression, euphoria, insomnia, mood swings, personality changes, psychotic episodes like hearing voices. One thing that happens that's kind of risky is atrophy of the adrenal glands. In other words, they shrink. So this actually is a weird thing. It's a paradox, because then you can't release your own stress hormones. You can't release your own cortisol. And that's a problem. If you can't release your own cortisol, and because you've been on these drugs, your adrenal glands have shrunk, that's going to be a problem if they suddenly stop them, because you need the steroids. A good example of not having steroids would be soldiers with post-traumatic stress disorder. They don't have any steroids. They lose all their sodium, they retain potassium, their blood pressure is low, they're always fatigued. It's a problem. So you don't want the point to get to the point where you have adrenal atrophy. And another condition which can result from using these steroids, and once again at a higher dosage for long term, months, is necrosis of the hip joint. It's very painful. It can require surgery to fix. It can lead to a hip fracture. It can contribute to a hip fracture. So if you know someone taking a steroid and is starting to develop knee pain or hip pain, they really need to contact their doctor. And once again, you can't suddenly stop a steroid like hydrocortisone if you've been on it long term, or you can wind up with an adrenal crisis, where your body is suddenly thrown into a situation where you're lacking cortisol, you have to allow the adrenal glands time to come back. Because there's been reports of severe nausea and vomiting in people where the steroids have been suddenly stopped. Some people even go into shock. Once again, if you're using the steroid just for a brief amount of time, 5 days or something, it's really not an issue. So that might be for bursitis, arthritis, tendonitis, severe back pain, something like that. It's really not a big issue. But long term, especially at a higher dose, you're going to run into the side effects. You're just going to go into the side effects. So if you're on steroids, you have to monitor your blood pressure. You have to monitor your blood sugar. If you're on it long term, the doctor has to check your bone density to make sure you're not losing bone. But what really worries me is medical doctors never discuss the nutrient depletions always caused by these drugs. They never discuss the nutrient depletions always caused by these drugs. And the drug companies don't share any of that information with the doctors. They're not required to. They probably don't even investigate it. So the big question to me, are the depletions of these nutrients aggravating the side effects, making them worse than they would have been, or causing them to begin with? It's probably both. So one thing your corticosteroid depletes, and it can happen very quickly, is your microbiome. And that's not good at all. Your microbiome is all the bacteria living with you, but also all the yeasts and all the viruses. So that's one reason why corticosteroids will affect your immune system. Good bacteria in your intestines reduce inflammation. Bad bacteria worsen inflammation. So if you're killing off your good bacteria, because those are the ones that tend to die first, you're going to have a problem. Plus, you could wind up with that super infection by the yeast living in your intestines. If you kill off the good bacteria, the yeast are no longer held in check. Your immune system isn't working well because you're on a drug that suppresses the immune system, and the yeast starts to grow and spread. It could be quite dangerous. Many people die from yeast infections. They're not easy to treat, especially if they get into the lungs or the urinary tract. It's not easy to treat. A lot of these fungal organisms are resistant to the antifungal drugs. Plus, a lot of antifungal drugs are quite dangerous. They have a lot of side effects and they have a lot of interactions, and they could affect the heart. So if you're on a corticosteroid, you need to be on a safe, high-quality probiotic supplement, at least once every 2 or 3 days. Now, steroid drugs also deplete vitamin A. That's not good. Vitamin A is needed for vision. For your color vision, for you to see clearly, for you to see at night, you have to have vitamin A. But you also need vitamin A for your thyroid. Your thyroid controls your metabolism. It's needed for energy. It's needed for mental sharpness. It's needed to control your cholesterol and your heart rate and your muscle function and your liver function and your blood sugar control, etc. Thyroid hormone is made out of protein, L-tyrosine, an amino acid, and iodine. And you need vitamin A to load the iodine into the thyroid hormone. So if you're lacking vitamin A, your thyroid suffers. You also need vitamin A to create healthy cells for immune system function, and believe it or not, for the function of all your steroid hormones, your sex hormones, your adrenocorticoids that are involved with blood volume and electrolyte balance and blood pressure, and all of these other steroids that are involved, the corticosteroids involved with inflammation. So vitamin A is needed to make your skin. Vitamin A was originally called the anti-infective vitamin, and it's cough and cold season. So vitamin A is really important. So your skin's a barrier to infections. Your skin separates you from your environment. You need vitamin A to make skin, because you need vitamin A to make virtually all cells in your body. But there's also mucosal cells that line your respiratory tract, your throat, your nose, even your lungs. They also line your digestive tract and your urinary tract. Mucosal cells function as one of the first lines of defense against infection. You need one of the forms of vitamin A called retinoic acid that's produced by immune cells in these tissues. And these cells kill the infections. There are stay-put cells. You make a little white blood cell in your bone marrow called a monocyte. The monocyte travels to different places like your liver and your lungs, etc., and it matures into a stay-put cell called a macrophage. And this really is important for preventing infections and also getting dust and soots out of the lungs, etc. So when you're lacking vitamin A because of these drugs, there's a lot of problems with the immune system. Additionally, you need it for your T cells. Your T cells control the immune system, and they slice and dice cancer cells, they slice and dice viruses and bacteria. So when you're on a corticosteroid for an extended amount of time, you need some source of vitamin A. A second ingredient that you're lacking is vitamin D. It's not because the corticosteroid depletes you of vitamin D. I haven't seen that happen. It's because vitamin A is needed for vitamin D to work effectively, and you need vitamin D to fight off viruses and to prevent viruses from damaging tissues such as your lungs. So that's an issue too. Now, B6. If you're taking a corticosteroid long term, you're going to lose your B6. You need B6 for your lungs to work. See, that's one of the problems with the steroid inhalers, the corticosteroid inhalers for asthma. They deplete nutrients that the lungs need to function: B6, B12, folate, magnesium. So if you're on an inhalable steroid to treat your asthma, eventually it might not work because you're going to lose these nutrients, and if you lose these nutrients, your lungs don't function well. So make sure if you're taking a corticosteroid inhaler, like Decadron inhaler for asthma, you need to be on B6, B12, folate, and magnesium for your lungs to still work. But B6 is commonly depleted by these drugs. You need B6 for the strength of your heart. You need B6 to lower your risk of colon cancer. You need B6 to prevent nerve damage, peripheral neuropathies. You need B6 to prevent carpal tunnel syndrome, that pain syndrome in the wrist. You need it to prevent diabetes. Now, some studies are showing that when you give B6, it has protective effects in the brain. It helps with blood pressure. It helps with all kinds of pain, especially nerve pain. So that's a nociceptive effect. The experience of pain through nerves that is specific for pain are called nociceptors. It has anti-tumor effects. There is definitely research that taking B6 or having good blood levels of B6 lower your risk of colorectal cancer, lower your risk of pancreatic cancer, and like stomach cancer and other digestive tract cancers. B6 may even reduce the risk of ovarian cancer. It might help reduce the risk of all cancers. B vitamins are some of the strongest things you could take to lower the risk of cancer. Riboflavin, which is B2, methyl tetrahydrofolate, which is folic acid, B12, like methylcobalamin or adenosyl cobalamin, B6, which is pyridoxine or pyridoxamine or pyridoxal 5-phosphate. There are different versions of these things. Later in life, B6 has been shown to help prevent depression, and in fact, later in life, having adequate levels of B6 in older people like myself, they have better memory and they stay free of dementia. So it's even more of a problem in us elderly people. Now, folate, most vitamins use synthetic. Oh, you know what? I better stop. Wow, we're getting into time here. I better stop at this point, and I'll continue this in a second part of this episode. So thank you for listening to Invite Health podcast episode. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Metaverse. I think that's the new name for Facebook, Twitter, and Instagram at Invite Health. Hope to see you next time on another episode of the Invite Health podcast. So look for part 2 of this. We're talking about the nutrients that are depleted by corticosteroid drugs. Thanks for listening. Jerry Hickey signing off.